Addiction is a powerful, complicated disease, and when it comes to opioid addiction, your doctor could have a tremendous influence over whether or not you become addicted. Karen Abernathy takes a look now at the doctor's challenging role in the height of this country's opioid epidemic.
That's right, Hugh. Now, opiates have been used for centuries and are routinely and effectively used for the treatment of acute severe pain following trauma or surgery, also for patients with painful terminal diseases. Now, in these short-term situations, they usually are not considered a problem, but with more and more people suffering from chronic pain, the dilemma is becoming more challenging for doctors and their patients.
The numbers are staggering. Opioid prescription use is a bigger problem in the U.S. than anywhere else in the world.
In the United States, we make up 80% of prescribed opioid medications, and I think that's just crazy amounts.
Dr. Joe Chen is a pain specialist who has worked in pain management for more than 20 years on the coast. And during that time, he has seen the use of opioids increase dramatically, in part due to trends he remembers that started in the 90s.
It became common, standard practice, to treat pain, chronic pain with chronic opioids. And with that, the physicians got more comfortable in prescribing it, more of it got prescribed, and the long-term consequences we weren't really aware of until today.
And for doctors like Chen, a growing population of chronic pain patients, an estimated 100 million in the U.S., makes it even more difficult today. But he says he's working to stay on top of it to help minimize those potential negative consequences.
When patients come in to me and they tell me to fix them, I tell them I can't fix you. You know, we're going to try to help you to cope with your pain better, and you have to learn life skills to keep the pain away as well.
Because of that strategy, he says a lot of his chronic pain patients have been on the same dosage for 20 years, and that's key.
You don't need to just keep escalating the dosages, and you want the patients to take the medicines appropriately.
He says a big part of the addiction problem is opioids cause the release of certain pleasure centers in your brain, dopamines, and patients get addicted and keep wanting to increase the levels.
There are other ways to increase your dopamine levels. You can exercise, you can interact, learn something new, go out into the world, especially what they've shown in studies that when you use your mind and challenge it, that the dopamine levels actually increase.
Even doctors who are not in pain management have to deal with the struggles of preventing opioid addiction among their patients.
As we as physicians are becoming more aware of the problem nationally, we are trying to scale back how much opioids and narcotics we write prescriptions for.
General Surgeon Dr. Paul Mace says he prescribes low doses for his surgery patients and only for a few days. And sometimes, if patients come back and ask for more,
if I can't identify anything, either through physical exam or testing, then I will counsel them and say, hey, look, I'm sorry, but I don't think you need additional pain medication.
Still, stricter guidelines and a growing reluctancy to write prescriptions makes it harder for patients who really need the drugs.
I understand the need to prevent fraud and try to control the narcotics that are being prescribed, but then it also puts an inconvenience on the legitimate patient that truly needs the pain medication.
And that's a concern pharmacist Larry Cron shares, adding that blanket guidelines often hurt the patients who need the drugs most.
I've had cases where cancer patients can't get their medicine filled because the insurance company don't want to cover it because the CDC has come out and said, oh, you should only write for so much narcotics. And if you got a cancer patient, you need to throw those regulations out the window and take care of your cancer patients.
Pharmacists play a critical role in fighting the opioid epidemic, and they do have a way to help monitor patients who shop around to get more prescriptions.
And we can go check online and check and see if they are doctor shopping, and in that case, we quit filling for them.
Dr. Chen says there are no easy answers and says it all goes back to treating the whole patient and not just the pain.
To get their life back, especially if they have chronic pain, they have to take care of themselves. I always give the analogy to my patients, if you have a car and that's the last car you're ever going to drive, how are you going to take care of it? Well, I tell them that's the last body they're going to have. They need to take care of what they have.
And if you do need to take opioids for temporary pain, limit the days to 2 or 3 max if possible. Studies show the likelihood of chronic opioid use increases with each additional day the medication is taken.
Karen, thank you. And you can join us tomorrow on Facebook. Dave Elliott is talking with addiction experts at noon. And right here on the WLOX News Now app, we have an entire section devoted to opioid abuse. It's full of great information to use if you or someone you know is facing an opioid addiction. You can find that in the App Extras section.